So if we look here, the muscles of mastication, the first one you see, the most superficial one, is the masseter, right? Okay, and the masseter goes from that angle of the mandible up to the zygomatic arch, right? Okay, so its main action is to do what to the jaw? Closure, right? Okay, and then because it attaches on the external surface of the mandible, it's going to do what? Deviation towards the same side, right? Ipsilateral deviation, okay? So then we cut through the mandible, and we're going to reflect it back, and what we see here, this is the temporalis, right? And temporalis attached to, if it was still here, that coronoid process of the mandible, right? Okay? And it also does what? Closure or elevation of the mandible, okay? And then when we peel it back, all right, we're going to see two muscles that are on the internal surface of the mandible. So we cut a big chunk of the mandible out. This one here, that's the medial pterygoid. And remember, medial pterygoid is the mini masseter. So its fiber direction is the same as the masseter, that sort of oblique. And so it's also going to do jaw closure, all right? But it's because it's on the internal aspect of the mandible, now when it shortens, it's going to cause deviation to what side? Contralateral side, right. Okay, so that's medial pterygoid. And then we've got the lateral pterygoid up here. All right, lateral pterygoid has two heads. It has this smaller superior head, and then it has the larger inferior head. All right, and so it's they're both sort of triangular in shape. The inferior head is the one that attaches to that lateral pterygoid plate. And the inferior head is the one right here, that's the temporomandibular joint. All right, and we can see how, remember, it attaches directly into the capsule, and one of the main actions of it, and one of the things that we'll use therapeutically, is the fact that it also has attachments into that disc, right, the disc of the joint, and so we can use it to help cause movement of the disc. Okay, all right, so there's the joint space itself, and so you can see how that lateral pterygoid attaches right in to the capsule and has some attachments onto the disc. And the other cool thing you can see, based on where they made the cut, is you can see right down into that maxillary sinus right there. Okay? All right?